Dumelang Afrika Borwa, and welcome to Tiny Matters with Dr. K. Happy Heritage Month. I'm so proud to be a part of this diverse and colorful nation. Okay, so let's be honest. If you've been a parent for more than a week, you probably have already become way more interested in somebody else's bowel habits than you ever thought possible. You've stared into nappies like you were reading a novel. You've texted your mom and a friend about what came out. Some of you have even taken pictures, and many of those pictures have ended up on my phone. Today, we're talking about poop. Tiny human poop. And why, as funny, gross, or awkward as it may seem, it matters. Because here's the truth. Poop is one of the most underrated indicators of your child's health. It's free, it's available daily, and if you know what you're looking for, it can tell you more about your child's health than a single blood test. So why does poop matter? Poop is your child's daily personal health record. It reflects digestion, hydration, health, diet, and can even detect hidden illness. Many years ago, before we had special tests and scans, doctors would examine and smell poop to detect what was causing illness. You don't have to go that far, but you should know the basics so we can spot if there's trouble early on. Bonus, kids are creatures of habit, so if their poop changes suddenly, it tells us that there's probably something going on. So what does normal poop look like? Newborns pass a first sticky stool called meconium. It's dark green and is basically a product of everything that was swallowed during the pregnancy. It also tells us that the gut has formed normally. Breastfed infants will pass a yellow, soft, soupy stool that almost looks like butternut soup. Formula-fed babies will pass a more tan or green stool that is somewhat thicker, almost like yogurt or peanut butter. As your child gets older and you start to introduce solids, colors, and textures, you will notice that the poop becomes smellier, thicker, and may even have food bits inside. Don't be alarmed. So how often should your child poop? For toddlers and beyond, ideally 1 to 2 times a day. It can extend to 3 or 4 times a day, but only normal if the texture remains unchanged. A normal texture is generally like toothpaste or ice cream. So what is the normal color of poop? Brown poo reflects digested food, bile products, and broken down red blood cells. Green poo is common with leafy vegetables, iron supplements, or a faster gut transit. Yellow poo can be normal in babies, but in older kids might be pointing to a rapid transit or infective diarrhea. Black, tarry stools are possibly digested blood, unless your child's on an iron supplement. And red, sometimes food like beetroot, watermelon, tomato skins, but sometimes blood. If you're unsure, ask your healthcare provider for a stool test. Now, nothing stresses parents out more than thinking there's blood in your child's poo. So how do we tell the difference between food and true blood? Blood is usually streaked on the outside or mixed in, and a darker red or maroon. Food pigment evenly covers the entire stool. Beetroot gives bright pink to red stools and often stains the urine as well. Tomato skins show up as visible red flecks. Red velvet cake is the ultimate faker. But again, it would usually be the entire consistency of the stool that takes on this red-maroon tinge. And now we move on to texture and consistency. We like to use something called the Bristol stool chart to give us an indication as to whether the stool is normal or not. The stool is divided into 7 types. Type 1 to 2 are pellet-like stools that often reflect constipation. Type 3 to 4 are soft and smooth, the ideal stool. Type 5 to 7 is when the stool is mushy or watery. It's often reflective of diarrhea or overuse of laxatives or stool softeners. Toddler's diarrhea is another entity we see often. It is common between the ages of 1 to 5 years. The stools are generally loose with undigested bits of food inside, but the child is otherwise healthy and growing well. Often, it is linked to high intake of fruit juices. The best way to get rid of this would be a balanced diet with limited fruit juice intake and high fiber. There is no need for medication unless the symptoms change. So when do you worry? Anytime there's real blood in the stool. If the stool is black and tarry and your child is not on iron supplements, a diarrhea that persists for more than 2 weeks, or with more than 5 loose stools a day, severe pain, vomiting, or abdominal distension, or if your child is just not growing well. Now let's talk constipation. Constipation is one of the most common reasons why children come to see me in my practice. It is common and would usually occur around the time of starting solids or starting school. The problem with constipation is it has come with multiple old wives' tales on how to treat it properly, including suppositories, traditional enemas, castor oil, all of which can cause extensive damage to the intestine of your little one. The overuse of enemas can cause damage to your child's rectal tone, and the use of suppositories can result in dependence. A better approach would be to introduce more water, fiber, fruit, and gentle stool softeners under medical guidance. I've had poop described to me as a melted Kit Kat, mashed avocado, or my personal favorite, the inside of a meatball. So keep being creative. It helps us help you figure it out. I see you, parents. Let's bust some myths. Myth number 1, as long as my child is pooping, everything is fine. Fact, frequency is only one part of the story. Color, texture, and associated symptoms are equally important. It is very common for children who are severely constipated to pass a stool every day. Myth number 2, bright red is always blood, always dangerous. Fact, like we said, more often than not, it's diet-related, typically red velvet cake. But if in doubt, always get it checked, especially if there's pain, fever, or your child looks unwell. Myth number 3, a clean out with a good old-fashioned enema is always a good idea. Fact, it may give quick relief, but it's not a long-term solution. Long-term use of enemas can cause overdependence and may mask underlying causes of constipation. So I've given you a lot of information about poo, but if you use these 3 tools, you won't go astray. Number 1, track. Note frequency, color, and texture. Number 2, think. Any new foods, illness, medication? Number 3, talk. Reach out if something feels off. Poop might seem like the last thing you wanted to talk about, but it's one of the most important things to discuss. Here's to every parent who survived the blowouts, the bathroom emergencies, and the mysterious stains. You're doing better than you think, and now you know what to look for. If you enjoyed today's show, feel free to like, subscribe, or share. And remember, stay kind and stay curious.